There's a thing called seasonal affective disorder that affects some folks every single year in the wintertime. It has to do with shorter days and the cold and I don't know. What do you do? Could you just move to a nicer climate? Let's find out. Dr. John Braccio joins us once again, Regional Psychological Services. What's up, Doc? How you doing?
Well, good morning to you, Mike, and Happy New Year as we go into 2024. Now, seasonal affective disorder, also called SAD, is a form of depression that occurs with the change of seasons. Tends to begin and end at the same time. Affects 5%, that's really a large set of numbers, of the U.S. population, lasts about 4 months, and is more frequent among women than men. It occurs in Michigan and similar weather areas during the winter when it is cold with short days and little sun. At a personal anecdotal level, I talked to 4 persons last week who all related they were getting tired of the overcast weather with the lack of sun and were getting run down and feeling sad. This is really pretty common for a number of persons this time of year. This condition clearly saps the energy and leads to a form of depression called SAD. Common characteristics of seasonal affective disorder would include like feeling sluggish, having low energy levels, sleeping too much or not enough, having difficulties concentrating on what needs to be done, substance abuse, feeling hopeless, and even guilty, Mike, even feeling guilty for the feelings of depression, having no interest in things that normally keep the person interested and sometimes even exciting, feeling sad and not enjoying good portions of the day, if not the whole day, weight gain, changes in appetite that can include a craving for foods that are high in carbohydrates, and even suicide ideation and feeling it's just not worth going on with these feelings. Fortunately, suicidal symptoms and suicide ideation are really not typical, but really there's something to be aware of in yourself and someone else if you really care for. There can be seasonal affective in the spring and summer, but percentages are much higher in the northern parts of the country, and really that doesn't relate to what we are right now, say in Michigan. So what happens when you run into this situation? Well, what you have to do, you really have to look forward to solutions. But maybe before the solutions, you have to realize what happens. Well, the causes of SAD or seasonal affective disorder include a drop in serotonin levels, which is the brain chemical or the neurotransmitter that affects the mood of persons and can play a major role of SAD. A lack of sunshine can also cause a drop in serotonin that may bring about depression. Another cause can be melatonin levels, which can negatively impact the balance. Melatonin in the person, which impacts a person's sleep patterns and overall mood. Additionally, your biological clock, your circadian rhythm, can disrupt your body's internal clock by having a lack of sunshine that can bring about depression. Now, if you feel you're becoming particularly sad, anybody listening, as the winter season, progresses with a lack of sunshine, short days, and cold temperatures, well, remedies include medication for depression, counseling, exercising always helps, replacing negative thoughts with positive thoughts, a light box that replicates actual sunlight. I know a lot of people that use these. Another thing, if you get a chance, if you can get a vacation away, a little time away where the parts of the country where there is a lot of sun and warmer temperatures sometime in the winter, that can be helpful. Not everybody can do that, but if you can, that can be a boost. And many persons just accept they have SAD. Now, this is unfortunate, and it is sad. We'll use another use of SAD, and do not do enough to try to overcome it. Because if you start having troubles with SAD, with substance abuse, or problems with work, family, or school, social withdrawal, or for sure with suicide ideation, these type of thoughts, well, it's time to strongly consider meeting with a therapist who's an expert in SAD, and also your medical doctor for potential medication and advice on how to best take care of yourself mentally and physically. And if you're a person that happens yearly, well, it's certainly wise to seek out some treatment before it begins. Because I'll tell you this, Mike, this can be pretty overwhelming to a lot of people. If you don't have it, you might say, well, I don't understand where someone gets it. But really, when you get short days, you get cold weather, and there's no sun, for long periods of time, that can be, just even saying it can be depressive for a lot of people. So it really is important that you kind of really do things to make yourself feel better. I know in my office I even have a nice sunset picture, which and even the painting, it's pretty bright, the sun, which I like. How does that sound? Sometimes just to have it. So there are things that we can do, so we might just as well do it rather than just mope around and run into a period of time that for some months of the year that we can be not functioning at a high level, which is really what we don't want to do. We want to move forward and have a successful, happy life as much as we can year-round, not just when it's warm and sunny out. How does that sound for a positive view?
I wish it had a different acronym. SAD. I mean, it just says you're sad. Well, just saying sad makes me sad. Can't we have? But you know what? Here's the thing. Here's the thing, though. We call it a disorder, but really, isn't this in order? I mean, we sleep more, we're sluggish, we eat more. We're kind of like going into hibernation mode, right? We're naturally, it doesn't seem like our human bodies are created to do a whole lot. If we live in the winter climes, to do much. We're supposed to get it all done in the warmer temperatures, and then wintertime you just do less, and you know what I mean? But in the Industrial Revolution, the industrial age we're in, the technical age we're in, we have to perform 365, 24/7, and that's not normal.
Well, I think you just hit it on the head. Like, otherwise, you could do your show from 8:30 to 9, okay? I mean, because of the winter, and we could go to a 2-hour workday. No, unfortunately, that's not the way the world works. So what we have to do, we have to compensate for it, which people do. And if it affects you, we're looking at 5%, 1 in 20. Then we just have to find ways to deal with it, particularly if you start, abusing substances, if you start being sluggish, if you start having problems interacting with family, if you just find that you're just not functioning, then you do need to do something about it, because it can be a pretty unhappy time for you, and of course everyone around you. Because depression is not something that just impacts the person; it impacts everyone around them, because inadvertently they don't plan it, but they kind of take everybody down with it too. So it is important to look into potential medication, look into a light box, look into changing your rhythm, changing what you're doing, and just trying to be positive as much as you can. And exercising is good, and you don't want social withdrawal. You don't want to just kind of disappear. And a lot of people really do that, Mike. People, I'm sure you do, that just kind of, they hibernate themselves, like you say, in the winter. So again, we don't live in a cave now where we can just spend most of the day. We do live in a world that we have to move forward and try to do the best we can, and realize there are chemicals like the serotonin I mentioned, that's something that certainly does eat melatonin. I mean, these are parts of who we are, and the biological clock, the circadian rhythm. So these are things to take a look at, and what we try to do is function as best we can. And there are tools, there are strategies, always replacing negative thoughts with positive thoughts, trying to be doing things to keep you going, controlling what you eat. I mean, I don't mean just for New Year's, like you mentioned, but just find a lot of people just when they're depressed or down, eating, you never run into that eclair, with it chilled
come on,
inside, chocolate on top. Oh my goodness!
Stop it! I gained weight just you talking. I just gained weight.
I'm just saying, these are things we do have to watch out for, because we don't want to have seasonal affective disorder or SAD really make us sad and really put us down. We want to move forward and try to enjoy all times of the year. Unfortunately, a lot of people do. It's not like everyone, but it's that 1 in 20 that gets it. That's a pretty large number if you consider that. Really, that's a lot of people. So we want to just be as happy as we can be and live a happy life.
There you go. I want to do that all the time, even in the summertime. Dr. John Braccio, ladies and gentlemen, Regional Psychological Services. We do this every Tuesday. A little free advice, a little free counseling, if you will. Get a hold of him, drjohnb.com. And Happy New Year, Doc. We'll talk again next week, huh?
Listen, same to you, buddy. And Owen, who works with you, a great guy he is. So anyway, look forward to talking next week, buddy. Bye-bye.
All right. See you later. 1320 WILS. Mike Austin back in just a minute.